Welcome to the webinar on successful strategies for improving adolescent health. This is one of a series of webinars highlighting local, state, and national efforts relating to the Office of Adolescent Health, national call to action to improve adolescent health, and development called Adolescent Health Think, Act, Grow, or TAG. My name is Evelyn Kapler. As the Director of the Office of Adolescent Health, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health out in the field. This webinar will highlight the good work that was done in Chicago under the leadership of Suzanne Elder, who served as Program Director for the Office of Adolescent and School Health for the City of Chicago. Before I turn it over to Suzanne, I'd like to tell you a little bit about the Office of Adolescent Health and Think, Act, Grow. The Office of Adolescent Health is located in the United States Department of Health and Human Services, and we've just celebrated our 5th anniversary after having been first funded in 2010. Congress charged the Office of Adolescent Health with developing a national plan for improving adolescent health. We've used our limited resources and the input of experts to synthesize what we know about what works to spur action in support of adolescent health. The TAG call to action is a first step. We're glad to be able to shine a light on an outstanding example of a city putting TAG into action. TAG builds on the collective work and insights of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, yet there are many missed opportunities to promote adolescent health and to intervene promptly as challenging health issues emerge in adolescence and young adulthood. TAG is a comprehensive, strengths-based, positive youth development approach to adolescent health, rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations, and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: to raise awareness about the importance of adolescent health, to engage stakeholders, including youth-serving organizations and caring adults, to get adolescent health on the national agenda, and most importantly, to spur action. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health developed by the U.S. Department of Health and Human Services. And more details about TAG can be found on the Office of Adolescent Health webpage. Before we begin, we'd like to point out that the content and views in the next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health. Now I'd like to turn it over to Suzanne Elder to talk about what Chicago's been doing to improve adolescent health. As I mentioned earlier, Suzanne was the Program Director for the Office of Adolescent and School Health for the City of Chicago. Most recently, she served as the Director of Partnerships to Improve Community Health for the Cook County Department of Health. We're pleased to have Suzanne with us to share her experience about Chicago. Suzanne?
Thank you, Evelyn. That was a lovely introduction. Everyone, thank you for joining us today. I think we have some nice material to share with you and review some of the experiences and successes that we had in Chicago. As some may know, Chicago has historically had high teen pregnancy rates and STI rates higher than other major metropolitan areas, including New York and LA. So Chicago faced an interesting challenge. And to address that challenge, the Chicago Department of Public Health and the Chicago Public Schools joined forces to address these adolescent health issues and others. The Teen Pregnancy Prevention Initiative in Chicago was funded by the Office of Adolescent Health. This is Evelyn's office in Washington. And it covered two key areas. The first was the Teen Outreach Program, which is a positive youth development program that was classroom-based and was managed and directed by my colleagues at CPS, Chicago Public Schools. The second part of this work was the policies, systems, and environmental changes that were necessary to support establishing adolescent health as a health priority in the city of Chicago, but also supporting it and advancing it forward. And that work was largely done out of my office at the Chicago Department of Public Health. The next slide, please. To begin this work and to ensure that policy and program gains could be sustained beyond the term of the grant, the city developed a youth-focused action plan. And it's important to note that this plan was authorized by the city and authored by youth advisors, as well as more than 50 health, policy, and education experts from all across the city. It was a significant collaborative effort across stakeholders, community interests, the city agencies and departments, and it took about a year to pull together. The plan articulated specific and measurable goals, strategies for achieving them, and policy recommendations. This is probably not unfamiliar to a lot of folks who work in public health and community-based healthcare. But what this legacy document did, at least within the context of the city of Chicago, it did three important things. It elevated the visibility of adolescent health as an area of concern and warranting investment. It focused the efforts of city agencies and community partners. And I think most importantly, it established youth as an authority, a constituency to be considered when making large-scale strategic investments in public health. Next slide, please. So, when people think of multi-sector collaboration, I think often people think about times when government or not-for-profit community groups and others come together to solve some singularly large or complicated problem. But multi-sector collaboration can also be a really powerful strategy for innovation. What happens when you ask students or coders or designers to solve public health problems, you get very interesting solutions that serve and support public health but don't necessarily look or behave like a traditional public health product, right? They're different. They're a little wonky, they're a little unusual, and oftentimes they can be very effective. So one of the things that we worked on very consciously is recognizing that youth they're more than just the recipient of our services or our good thoughts or our expert thinking. The truth is that they are authors and advisors. They're team members and they're leaders in their own right. And we thought and believe strongly still that they're the key to leveraging the assets from these multiple sectors and sources to create the public health solutions and interventions that work best for them. Their authority, though, is beyond just that. They are adept at identifying the issues that are most important within their peer groups and their communities, and they're singularly expert at elevating awareness among their peers. They bring an authenticity and an authority to when they bring their concerns to policymakers, and we found this to be especially useful when we were doing policy work with youth. And we'll get to that in just a moment. Can we go to the next slide, please? So this is a slide that I think some may be familiar with, and this is the slide that visualizes what is design thinking. It's common within designers, creative types understand this intuitively. Businesses coming to understand this even more. But what I find interesting about this is a strong demonstration of the natural way that youth think. So we understand that traditional problem solving starts by defining the parameters of the problem, right? And that's the first strategy to define the solution. We start with what is not possible, what isn't working, etc. Well, design thinking starts with yes. It starts with the solution, and then it works backward and then addresses the problem parameters. And those of you who work with youth, you know that this is absolutely how youth operate. By and large, their default mode is yes, we can do this. The solution is this or this or this. They're natural design thinkers. And this process, which is very organic and very un-public health, to be honest, it favors divergence, many solutions over convergence, which is typically what we want to do in public health, right? We build large partnerships and committees, and we seek convergence. The design thinking sort of flips that pancake and says we're going to find many solutions, not just one. It talks about problem-solving strategies that build naturally on the multi-sector collaborations that we mentioned earlier. And it's a strategy that also searches out outliers, those exceptions, those examples of practice that are outside the norm. And it recognizes that they have a seat at the table. When you're looking at this, we talk about emotional innovation in health communications, for example. When we talk about STI prevention, how does the message make our audience feel? Is it engaging? Is it repulsive? Is it inspiring? It's important to think about how it affects the individual in that way. Process innovation. How can something be done better? Some of the youth-focused policies that we're going to briefly look at in the next slide were all inspired by youth who recognized how to do something better. And then thirdly, functional innovation. Does it do what people want? Some of the most interesting work that was done at the city was school-based health services, the improvements in the STI screening program, improvements in delivering school-based oral health care. Now, in the middle, that little sweet spot, that's sort of the nirvana of design thinking. And that space is occupied by our friends at Google and Apple and some of those really exceptional organizations that synthesize all of these aspects brilliantly. But there's significant value and opportunity in the singular overlap in process innovation, functional innovation, and emotional innovation. And we're going to talk about how those three areas were worked on by youth in Chicago and some of the amazing products and successes that were realized. The next slide, please. So I mentioned earlier about youth-informed policy. In Chicago, each one of what we have here, 6 policy improvements that were realized were all first identified by a young person who was either on the wrong end of a poorly crafted policy or a very smart, ambitious student who recognized something emerging that the adults in public health hadn't yet realized. So, for example, the privacy of minors seeking sensitive health services, this dynamic was changing as Medicaid was expanding and private insurers were entering into the Medicaid space, where one's explanation of benefits were never sent out. Private practice was bringing in the habit, the natural course of their operations to send EOBs out. And suddenly, sensitive health services were being disclosed where they hadn't been before. This interesting change was noted by a student who brought this forward, developed a policy brief, and then championed it all the way forward to the State House, where legislation was passed last session to protect the privacy of dependent minors and others seeking sensitive health services. Similarly, students with HIV, there was an odious piece of legislation remaining on the books where public health departments were required to disclose the identity of students with HIV to principals. It's hard to imagine that in this day and age that would still be on the books or in any way practiced, but there it was. Similarly, there were 4 or 5 other things that were done. Most significantly, though, during the term that we were working together, we passed comprehensive, medically accurate sexual health policies, both at the state and local level. And at the local level, it included not just the policy piece, but training for teachers in every single high school, in every single elementary school, and mandatory minutes so that every child had age-appropriate information and education throughout their course of their schooling at CPS. The next slide, please. So youth-driven programs. This is a great example of a functional innovation. The condom availability program in Chicago started in 2013 and initially started with the idea of putting fish bowls in school nurse offices and providing condoms. And working with our youth advisors, we thought, well, perhaps we can do something better. Perhaps there's another way of addressing this and elevating the availability of sexual health resources in a way that engages conversation, engages students as advisors, authors, and creators. And so what we did was we coordinated and partnered with Columbia College, which is a local college here in Chicago, and we integrated a public health challenge into the curriculum in both product design and information design. And students, near peers, college students, designed the condom dispensers that are now installed in and throughout Chicago public schools. And you can see here that the students created two different designs. One of them was designed exclusively for male condoms and is accepted as sleeve as it was distributed from the manufacturer. It dropped down into the top and dispensed it. And that's the one on the right. That also featured a really nice interface at the front where an 8.5 by 11 sheet of paper can be slid in and slid out so the messaging can change. So if it's prom or if it's turnabout or if there's a summer program, there is an opportunity for the school to customize the health information that's related to the condom dispenser. The one on the left, the bucket design, the one that sort of looks like a superhero helmet, was created to dispense both female condoms and male condoms. And what's really kind of lovely about this is that the students recognized that there was a need for both. And so rather than creating just one, they decided to create and manufacture two. And so far that these are installed in 53 of Chicago's public high schools, and the reception so far has been remarkable. Next slide, please. The Condom Availability Program was part dispensers, and you can see that in the far left column. It included the dispensers and the face inserts. And there was also the partnerships, right? Chicago Public Schools, the high schools, community partners. But we did more than that. We also worked to develop a condom finder mobile application. And it enabled students in a handheld way to access the nearest free condom, STI test, birth control, and other providers. Those features are still in development, but the Find a Free Condom is definitely operational. And again, we had a different set of partners there, all youth-focused. We had student coders. They were led by Greater Good Studios, a design firm. We partnered with the AIDS Foundation and youth groups like the Peer Health Exchange and Mix a Challenge. This work was supported by the work we mentioned earlier, some of the legislative affairs, both the sexual health education policies as well as the EOD policies. And then we also complemented this work by public awareness campaigns that really reached out throughout the community. For example, the Chicago Wears Condoms campaign, which was launched, I think it was December 1st on World AIDS Day, was in development for several years with student designers and student contributors, and it included not just the public or outdoor display advertising, but it included safer sex kits, wristlets, and it, more than anything else, it established a conversation amongst youth and youth-serving organizations that was not just about the health issue itself, but about the youth as the creators. Can you go to the next slide, please? We talk about youth as creators. I know it's often sort of a unfortunate standard cultural meme, perhaps, that adolescents are troublesome or adolescents are difficult or wild or whatever it is. But it's remarkable if you step away from that view and really see adolescence as an amazing period of opportunity. The beauty and the opportunities of adolescence shine through. And that is what we were able to realize when we recognized what other researchers, social researchers, have known for a very long time by employing this theory of positive deviance. Those outliers, those individuals who are solving the problem in a different or unique way, are often the leading edge. They are your genius in residence. So here's a little story about an individual that I think traditionally may not have received such a warm welcome. There was a young man who, in one of the high schools, he had stolen or taken all of the condoms that were languishing in the school nurse office. And he was found later in his neighborhood selling them to, friends and neighbors and people within the community. Now, when this was found out, the school contacted me and said, "Oh, Suzanne, we are so sorry. He had taken all these condoms, and we will never let this happen again." And I thought, oh, no, I think actually we want this to happen again. This young person had figured out a way to solve a problem and meet a need in a way that was far better than anything we had done. And so what we did was we branded him. We created this idea that teen health agents could serve their network by leveraging their status as sort of the guy or the gal in the know. So these outliers, they point to existing solutions that are scalable, that are interesting, that are fun. And finding these outliers means that you can look at situations differently and you can find solutions that are accessible, affordable, replicable, and scalable. And the other thing to think about when doing this is it's important to recognize that what works for adults may not be something that works for youth. Next slide, please. So a third area, emotional innovation. So what does this mean? Well, how do we make people feel about adolescent health? It's a politically touchy subject for some constituencies in some communities. So how do we enlarge this conversation and how do we break through? Well, one of the awareness campaigns that we did in Chicago was the Unexpected campaign. And it was a series of images of young boys depicted as pregnant. And what it did was it challenged gender stereotypes. It was very much on the nose, right? But it's also interesting that it did not test well with adults. In fact, no adults liked it. My department didn't like it. My commissioner was a little worried about it. It was not something that pleased adults, but it resonated strongly with youth, and sometimes positively and sometimes not so much. Some teens were intrigued and curious, others were grossed out. But what it did do is it got people talking, right? It got to talk about what it would or how it would be different in a world where boys could get pregnant. Wow. It took off like wildfire. The image was provocative, it was controversial, the message itself also. And it did what it was supposed to do. We were very fortunate, a little timing, and a great campaign, which, by the way, serious props to Serve Marketing in Milwaukee. They were our partners on this. We were able to repurpose the campaign that they had run in Milwaukee about 7-8 years ago. And these generous creatives allowed us not only to borrow their images, but they let us retheme the entire campaign so that it worked in Chicago. And work it did. And if we could go to the next slide, please. We earned more than 1 billion media impressions. My colleague Rayed Mansour at Chicago Department of Public Health stopped counting at a certain point. Our systems were just overloaded. We earned media all around the globe. It was an astonishing moment, I think, in adolescent health. It made national news, and it made international news. It occupied sort of the media space for nearly a week and beyond. And it started conversations with individuals and institutions that had not yet really talked about adolescent health, and particularly teen pregnancy prevention, in a way beyond just focusing on young women and their role and their responsibility. So we counted this as a success. The next slide, please. I was talking earlier about how we really rely on youth as the authors, agents, and authorities of their own needs and their own communication requirements. And finding those relationships and building those relationships that worked and supported what they saw, what they needed was critical. I mentioned just a moment ago Serve Marketing in Milwaukee. Serve and Gary Mueller, these folks were beyond wonderful in helping us achieve this work. And they understand and really respect youth as the authors and agents of this work. So they worked directly with youth. This was not a pass-through other adults, and the youth were involved every single day. They collaborated directly with user experience researchers and designers, and they built mobile health apps, and they built these public awareness campaigns that we have celebrated very much here in Chicago. Here's an example of the Chicago Wears Condoms campaign. You can see on the right, this is a bus shelter ad that is actually still being displayed now throughout the city. Below, there's a web-based application that enabled individuals to find the nearest free condom. As wonderful and fun as these finished products are, I thought it would be nice to take a moment to talk about how we got here, because when you look at the final product, it all looks kind of fun and brilliant and effortless. And that's great, but it takes a little stumbling to get here, and I thought it would be useful to take a peek at that. Can we go to the next slide, please? So, oh, interesting. Let's hit that one again. Forward. There we go. You might remember earlier I was talking about the information design students at Columbia College. Well, when we started on this project, this was one of the first concept pieces. They had developed a series of images with Chicago's iconic skyscrapers enveloped in colorful condoms, with sort of imploring folks to be safe. And I thought it was lovely and clever and fun. And it was something we presented to the Chicago Board of Health. And it was published nowhere else except in those minutes. And surprisingly, that was found and picked up by a very vocal group who was very much against adolescents being sexual or having sexual health resources. And a big brouhaha came about. So this was actually scuttled as a result. Sad but true, but it informed the next iteration. The next iteration was a group of young people at Nick the Challenge who did a summer creative seminar with me, and one of the student collaborators had sketched out this really interesting sort of skyline with a banner that said, "Chicago Wears Condoms." It was building on this idea. And so we took that idea, and the students developed it further by working with the creatives that serve marketing. They were the client and worked with them directly, and it was fantastic. And if you can go to the next slide. And so this is what they came up with. We took the condom off of one building and they stuck it on another one. They found a different way to communicate the same message and still be clever. And then this work was developed beyond that, and now we have a citywide campaign of Chicago Wears Condoms, and it's caught everyone's attention and has earned lovely media here in Chicago, and it's continuing that very positive conversation about adolescent health. You can go to the last slide. Oh, sorry, not the last slide, is it? Yes, there we are. Sorry. So some of this work, there's three key pieces to how we were able to move forward and achieve some of this work. One is we cultivated ideas, and from unlikely places. Yes, we definitely consulted with the adult experts, but we elevated the importance and made central the role of youth. And the example I gave you of that one enterprising teen who showed us how to meet a need that we weren't meeting, that was like striking gold. We convened partners who thought differently than we did. You know, we didn't just bring in the usual suspects or the usual partners within, public health. We reached beyond that. And we brought in designers, and we brought in coders, and we brought in university professors, and we brought in youth that were focused on primary prevention and advocates who were interested in secondary prevention. And we really enlarged the table. And that allowed us to test the viability and feasibility and even the desirability of some of the things we were thinking about. And then the other thing is that we championed a tolerance for risk and for iteration and for failure. In the short period of time that we have together today, I can't necessarily go through every single wall we crashed into, but I can assure you that there were many. It wasn't a smooth trajectory from, start to finish. And it was, I think, a really wonderful period of time where we were able to encourage in each other that experimentation and that tolerance for trying something, and even if it failed. And then maybe even finding out ways to extract something useful or helpful from that experience. So next slide, please. So what are the lessons learned? Well, we're going to click through these one by one. So if you can click the first one, ideas are super sexy, no doubt about it, but they're not enough. You really have to have the ability to execute or the ability to build a team that can. The work that we were showing to you here, these would not be possible within the regular public health toolkit, right? We reached beyond those borders, and we found individuals in manufacturing and creativity and digital technology, and who could pull these things forward, who could actually execute. And the second idea is to know your audience. And guess what? It's not us. It's not the adults. It's not the experts. It's the youth. So when we think about advertising, we always want to know who our target audience is. Well, we need to trust that and understand and believe that they know what it is that they need or what resonates and works for them. And three, many of the solutions already exist. They're just not necessarily where you think they are, and they're not necessarily going to be offered by who you think would be offering them. You know, who would have thought that a kid who steals condoms, not really steals condoms because they were free, so there's nothing you can really steal there, would end up being such an inspirational agent within our conversation? I couldn't have predicted it, but he was. And then finally, and I think this is important, is, tokenize use at your peril. We, I think as adults, sometimes can make the mistake of discounting their input or their expertise or their understanding of their own lives. And I think when we do that, we miss opportunities to be genuinely supportive and genuinely in service to their health and their welfare. So that's what I have for you today. There is certainly more available to folks who are interested. Our colleagues at the Chicago Department of Public Health are always available to receive your call and in any way partner with you and share what was done here in Chicago. Like we were able to do, we were able to build on earlier successes in Milwaukee. We are happy and have been happy to provide that support to other partners throughout the country. So thanks for taking the time to be with us today.
Thanks, Suzanne, for that terrific presentation. Now we'd like to take a few minutes to ask a few questions about some of the work that you've been doing. First, we know that building community-wide support and funding for adolescent health is challenging, and the focus on sexual and reproductive health is a good developmental fit, but it's also sensitive. What strategies did you use to navigate the debates and advance your work?
Oh, wow. Well, we employed a couple of strategies, Evelyn, and I think all of them were strongly anchored in this first one, and that was we were able to establish institutional support, right? The Chicago Department of Public Health and the Chicago Public Schools Office of Student Health and Wellness, they leveraged the expertise of their staff and their institutional credibility to establish adolescent health as a priority. And that was pretty significant. That meant that, these institutions as well as the mayor's office chimed in as well as city council several times in support of this work. That's part of it. But the other part of it was made possible, frankly, because of the support of your office, right? We had the evidence case to be made, certainly, and all of us who work in public health understood that. And most of this work was made possible by that initial funding that enabled us to do this baseline work within the city of Chicago. It was absolutely instrumental. Secondly, I think we got the unit of analysis right. We engaged youth as partners, not as, mouthpieces, not as, tack on at the end. And we kept the focus on what they needed, not necessarily what the adults wanted. That took some doing at times, I'll be honest, but it was I think the proof is in the pudding. I think it was the right thing to do. I think the third thing that we've tried to do is enlarge the audience. We wanted to make the conversation more public, less public health, right? We wanted it to be more retail, which is why we took an approach both with the Unexpected campaign and Chicago Wears Condoms campaigns, a little provocative. We wanted to get people talking. And we just didn't try to hold on to the narrative too tightly. And for, honestly, a municipal agency, I got to say, super props to the Department of Public Health. That was a Herculean thing, I think, to do. It's outside the norm. I also think, and maybe this is an area that could be developed further, but I think we made some strong headway into framing adolescent health as a chronic disease prevention strategy, not a problematic behavior that we have to, throw condoms at, or, sexual health education. It was more than that. I mean, developmentally, yes, that's definitely what's happening and emerging at that stage of life, but it's laying down that foundation for a long, healthy life. So we moved a little bit beyond just sexual and reproductive health. I think those are the 4 ways that we tried to navigate the debate.
Great, thank you. And, policy and funding changes are really reshaping public health. We know that local governments are shifting away from the provision of direct services, while not-for-profit partners are building capacity to take on more. What are your thoughts on how to establish and strengthen services and supports for adolescents in this new environment?
Yeah, well, that's emerging, and I mean, to be determined, but I think traditional public health as units of government, you're right, is giving way to more collaborative, community-based practice with more varied stakeholders, right? We are looking outside of our walls. We're looking to schools and libraries. We're even looking at post offices, places of faith, grocery stores. All of these act as public health agents, right, to varying degrees. So I think in this new environment, local health departments are still chief conveners, but now that you have health networks and hospitals are also fulfilling a similar role because the funding mix is changing, which is driving a bit of that. So I would say to folks, if you don't already have established relationships with hospitals in your service areas, I'd say become involved, become an advisor for their community health needs assessment. Help them shape their implementation plans, understand what their priorities are, as derived from their needs assessment, and see where your work complements or supports identified health priorities, and see how you can build a role for yourself. The hospital and health networks have pretty strong incentives to address these priorities, and frankly to fund them. So some of that funding shift that we've been all sort of feeling and recognizing in recent years is going to come through different venues, and hospital and health networks may be one of those opportunities, because I think we can bring the expertise in the local partnerships to make the ground game happen, and they can bring the incentives that they have to maintain their tax status, as well as, of course, improve the overall population health of the people that they serve. I don't know, but I think that picture is still emerging. But I think it's an exciting opportunity, and I would definitely start by expanding the relationships with hospitals and health networks for sure.
Great, and I have a final question for you, and it goes to youth engagement. Can you tell us a little bit about why you think direct involvement of youth is so valuable?
Sure. I think it's the same reason direct involvement of, let's say, people over 65 are, absolutely critical when devising interventions or health services targeted to them. I mean, there's a wisdom in within groups, within communities, and recognizing that expertise already exists within those groups and communities, I think is key. I was just reminded the other day, a friend of mine works for AARP, and they have they spent really a great amount of money on rebranding recently, and they did it for some interesting reasons. One, being over 50 isn't what it used to be when AARP was founded, and so when they were going through this process, they didn't just turn to the 30 and 40 and 50-something creatives that were coming up with these new and clever ideas. The first stop in their reinvention was to their constituents, the very people that they were serving. They were the authority, they were the experts. And similarly, I think when it comes to youth, public health, and community-based not-for-profits and others who serve adolescents and child health would be similarly served by going to the source and recognizing the wisdom and the talent and the solutions that already exist within those communities.
Thank you, Suzanne. Thank you so much for joining us today and sharing your experiences with us. On behalf of the Office of Adolescent Health, I want to thank all of you for joining us to learn about OAH and TAG and to hear about the great work happening in Chicago. Again, I'd like to thank Suzanne Elder for sharing this story of what multiple agencies working toward a common vision and caring adults in partnership with young people can accomplish. We'd love for you to get involved and spread the word about TAG within your professional networks. And there are a number of ways in which you can do this. You can explore our website, you can check out the TAG playbook, and you can join us and join TAG and get email updates. I encourage you to notify your colleagues and grantees about TAG. I encourage your organization to use TAG action steps and resources. And if you use social media, you can blog about TAG. We have sample text on our TAG toolkit. And I encourage you to ask questions, share ideas, and stay in touch. You can use TAG social media tools to reach out to some of America's 42 million teens and the adults who care about them at TAG42mil hashtag. We encourage you to stay connected to the TAG call to action, and here's the URL for the TAG landing page. You can email us at tagteam@hhs.gov to let us know how you are using TAG and to share your successes and to share your thoughts and ideas for collaborating. And please follow us on Twitter at TeenHealthGov and monitor the hashtag Teen42mil.